Rabies is one of the deadliest diseases known to medicine. Once symptoms appear, survival is almost impossible. Yet, rabies is also one of the most preventable diseases in the world. This contradiction makes the situation in India especially tragic. Every year, around 59,000 people die from rabies globally. Nearly 20,000 of these deaths occur in India alone. That means India accounts for almost one third of all rabies deaths worldwide. This happens despite the fact that effective vaccines and treatments have existed for decades. Rabies is caused by a virus that attacks the central nervous system. It is transmitted mainly through the bite or scratch of an infected dog. In India, dogs are responsible for about 99% of human rabies cases. The virus enters the body silently and travels through the nerves toward the brain. During this time, the infected person may appear completely healthy. The incubation period usually lasts 2 to 3 months, but it can range from a few days to over a year. Once symptoms begin, such as fear of water, confusion, hallucinations, or paralysis, the disease progresses rapidly. At this stage, medical treatment no longer works. Rabies is almost 100% fatal after symptoms appear. What makes rabies unique is that it is entirely preventable before symptoms begin. Immediate washing of the wound with soap and water, a complete course of rabies vaccination, and rabies immunoglobulin for severe bites can stop the virus before it reaches the brain. So, why do people still die of rabies in India? The answer lies not in lack of knowledge, but in poverty, delayed treatment, and systemic failures in healthcare delivery. India records nearly 20 million dog bites every year. Most victims come from poor and marginalized communities where access to healthcare is limited and awareness is low. In many cases, bite wounds are ignored, treated with home remedies, or medical care is delayed due to cost or distance. Children are the most affected. Nearly 40% of rabies deaths in India occur in children under the age of 15. Children are more likely to play with dogs, less likely to report bites, and more likely to receive delayed or incomplete treatment. A single missed step in prevention can cost a child their life. Incomplete vaccination is a major reason for continued deaths. More than 20% of dog bite victims do not receive even a single dose of rabies vaccine. Among those who start vaccination, nearly half do not complete the full course. Each missed dose significantly increases the risk of death. Rabies immunoglobulin, which is essential for severe exposures, is often unavailable in public hospitals. When available privately, it is expensive and unaffordable for many families. Faced with high costs, some families delay treatment, others stop midway, and some never begin at all. Free roaming dogs remain the main reservoir of rabies in India. Current dog population control strategies have not been sufficient. High birth rates and short lifespans lead to rapid turnover of dog populations. Without sustained mass vaccination of dogs, the virus continues to circulate in communities. Scientific evidence from around the world is clear. Culling dogs does not eliminate rabies. Mass dog vaccination is the most effective and humane solution. Rabies also carries a heavy economic burden. Globally, it costs billions of dollars each year through healthcare expenses, lost productivity, and emotional trauma. For poor households in India, the cost of treatment can be financially devastating, forcing families into debt or delaying care with fatal consequences. India has taken important steps to address rabies. Vaccines are included in public health programs, surveillance systems are improving. A One Health approach now links human health, animal health, and community awareness, yet progress remains uneven. Rabies persists not because it cannot be prevented, but because prevention does not reach everyone equally. Every rabies death is avoidable. Every death represents a failure of access, a failure of timely care, and a failure of public health delivery. No child should die from a dog bite. No family should lose a loved one to a disease we already know how to prevent. Ending rabies in India is not a scientific challenge. It is an administrative, social, and moral responsibility. With strong surveillance, guaranteed access to vaccines and immunoglobulin, community education, and sustained mass dog vaccination, human rabies deaths can be eliminated. Rabies in India is not an unsolved mystery, it is a preventable tragedy. And every life lost is a reminder that prevention delayed is prevention denied.